So I've seen 7 bodies die by my side. And you'd think that the next minute you're also going.
When I came here, I was told that this bed, somebody was just removed dead. So I thought maybe, I didn't know what the future had.
Our mortuaries are full. We're actually appealing to people to remove their the bodies of their loved ones today, whether it's your friend.
This is the epicenter of the COVID crisis in Kisumu. And here, the truth, just like the virus, is out of control.
Not as calm. I'm one victim who is known all over Kisumu, so you can take it to the bank like this thing is real.
Naambia wanawajulisha kwa corona iko na waje watapata wasikia corona iko.
Hey, COVID is too much. Like you discharge a patient and one come immediately to fill that bed. Yeah, the COVID is just too much right now. Yes.
Inside these sealed-off rooms are people desperate for a miracle.
But I've lived because of God's mercy. And I really thank God for that.
I've come to know that what is killing people here, what can kill somebody is anxiety and fear. A lot of fear.
Oxygen supply is something that somebody should not joke with at this juncture. That's the most critical thing you can ever depend on.
COVID affects the respiratory system. Yeah, that's why when you're affected, the respiratory system is also affected, and that brings the difficulty in breathing.
That difficulty is experienced not only by the patients, but also in the 2 isolation centers at Jaramogi Oginga Odinga Teaching and Referral Hospital.
The staffing is not good at all. Like I've told you, we now have 34 patients up here. We are 2 nurses. I'm the in charge and the other one. So you see, I have to leave my administrative duties to go into the ward and help the nurse. She cannot do it alone.
We are experiencing exhaustion because the number of staff in terms of their ratio to the clients who need help keeps on diminishing because even the staff members get infected and therefore they're removed out of the workforce.
Also in need of urgent replenishing are personal protective equipment used by the health workers attending to the patients.
Like masks, gloves, the suit that prevent you from exposure, and special masks called N95.
The virus, according to the records at the 2 facilities, knows no gender or age.
Sometimes there are more males than females, sometimes there are more females than males. So it affects people equally.
Medics in gloves, masks and gowns are the only company those fighting the quiet and terrifying battles inside these rooms can count on.
I've been here, stationed here, for the last 9 days without moving.
The kind of care we're being given here is on top notch.
Sangine hata saa 9 usiku. Ukishtuka unapata hao jamaa washaanza kazi umwa. Wewe una habari. Ni watu wanashirikiana vizuri sana kazi yao. Hiyo ndio ninasifu zaidi.
For the first time, I've learned that you can have a seat cut below and do everything where you are. So it is interesting.
From the patients to the medics, the message for those of us lucky enough not to be here is the same.
Wear masks, keep social distance. It's not necessary you have to crowd. If you can avoid, the better.
So people of Kisumu should be very careful and exercise caution at this hour because the disease is real and deadly. This thing is a personal responsibility. If you are careful, you wear your mask, you wash your hands with soap and water, running water, you keep your distance, you don't go partying in crowded rooms. Like very often you find bars at 7 o'clock at the closure time, the revelers are locked inside, from inside, and they drink until almost morning. And there they don't observe all the rules. And that maximum transmission occurs. So basically we are appealing to people to restrain themselves.
So there's hope. So tell people there's hope.
Ouko Kusa, NTV.